and we get nothing out of it. When there's a need, we can't even access it.
Right now, those are all people from Canada and UK. I don't want to see any of you in a video like that. And that's why I do this. Are you going to fight this? Yeah!
We have two individuals to ask the microphone, so if you have a question, be prepared and we'll start taking questions. But first, Congressman Reichert is here. He wanted to come and hear what the doctors have to say, hear what you have to say. He's got another meeting he's got to go to, so he's asked for 4 minutes, and I gave you 3 minutes. So Congressman Reichert, if you want to come up and talk about how you're going to help us defeat this bill. With these bills,
thank you. It's great to see such a large crowd here tonight. You are the ones making a difference. I want to say I'm from the federal government and I'm here to help. Okay, here's the secret weapon. It's you and your voices. And I wanted to stop by and congratulate you for raising your voice. The silent majority is no longer silent. Over the past several months, we've had 7 to 8 hearings in the Ways and Means Committee. We've had a 16-hour markup of the bill where we considered amendments to the bill. 50 amendments, nearly 50 amendments of Ways and Means by the Republicans. Not one was accepted. One of those amendments suggested that members of Congress go into the public option as they were suggesting the All the Republicans voted yes. Guess what? It didn't pass. In the other 2 committees, the same amendment was offered in Energy and Commerce and Education and Labor. It didn't pass. All the Republicans voted yes. There is another plan out there. You have given us time, the time that we need to listen and to focus on what you all want in this bill and what we have heard. And if you go to the website and look, you'll see there are 3 bills that the Republicans have drafted. They include things like, number 1, tort reform. Number 2, let's address waste, fraud, and abuse. $10 billion a year wasted in the Medicare system. Let's not tax small businesses. I think that makes a lot of sense. Let's allow people to buy their insurance across the economy. Let's allow portability. People can take their insurance with them from across the economy. Let's get rid of the language on pre-existing conditions. Okay, there's a long list of things that you all want to see. We all in this room understand that our healthcare system, as it's called here in America, does need some changes, but 80 to 85% of Americans say, I like the healthcare plan that I'm on. What we don't like is the cost. So let's work on trying to fix the cost, lower the cost. And there's a list of things that I just shared with you. There's more in the bills that the Republicans are considering. Keep raising your voice, and we will keep speaking for you. I have been on MSNBC, CNN, Wall Street Journal interviews.
Shut down the Obama Nazi plan, right?
We have. Ways and Means Committee, I'll just share for all of you to know, I've already voted no on this plan once. If it continues in its same form, I will vote no again. This is wrong for America. We need to keep our freedom to choose our own healthcare system. We need to keep the freedom to make that decision between your doctor and yourself as to what your treatments will be. This is America. We should have that freedom of choice. And this morning, I don't know if some of you caught it on Fox News, but I think her title is the President of the Canadian Medical System, shared today that the Canadian system is in a state of collapse. So why do we want Canadian health care? We don't. Ladies and gentlemen, keep up the loud voice.